NMA members, and our national live viewing audience. We are so pleased today to come with you with this NMA Talk series. So the National Medical Association represents over 45,000 African-American physicians and the African-American communities and patients that we serve. We are the leading force in justice and parity, and we have been working, especially in this year of 2020, to ensure health equity for all of our patients. So tonight, for NMA Talks, this is a series where we allow ourselves to have dialogue on health, wellness, and how we as physicians and health advocates can ensure better health outcomes for our communities. Today, this session is being hosted by the NMA Council on Concerns for Women Physicians, where our council aims to address the interested needs of African-American women physicians and also the patients that we serve. We want to ensure that our voices are heard and that we are addressing issues that specifically impact African-American women physicians, such as equity, pay, and leadership promotion. For tonight, we will be having dialogue on how Black women across the healthcare spectrum are leading the charge in the healthcare evolution. How are Black women in clinical medicine, academic medicine, research, health policy, and government on the front lines to ensure that we are moving forward in a healthcare agenda that serves all? I'm glad to moderate this panel with my co-chair and vice chair of CCWP, Dr. Julianne Burt, and we have an esteemed panel with us this evening. So in order to start our panel session, we will briefly announce who our panelists are, and then they will give a brief overview of their role, their position, their affiliation, and then we will start with our questions. I first want to introduce our NMA representative, Dr. Brandy Freeman, who serves as the NMA Speaker of the House of Delegates. Dr. Brandy Freeman, if you would please introduce yourself to our national audience.
Okay, good evening, everyone. It is a pleasure to be with you this evening. As Dr. Passley said, I'm the Speaker of the House of Delegates for the National Medical Association, which is the legislative body making policy decisions for our organization. In my other life, I'm a general academic pediatrician practicing in Aurora, Colorado, and I'm really happy to be with you this evening.
Excellent. Thank you, Dr. Freeman. And next, we will recognize our second panelist, the Honorable Lisa Blunt Rochester, the U.S. Congresswoman from Delaware at large. You guys may know Delaware has been in the media just for a bit in these past few months, and so we are pleased that one of our Delawarean leaders are joining us this evening. Congresswoman Blunt Rochester, please introduce yourself to our audience.
Thank you, and thank you so much for having me, and thank you so much to the NMA for all your incredible work. I represent the first state of Delaware. We only have one congressperson, and I am it. And my background has been in everything from serving as Deputy Secretary of Health and Social Services in the state of Delaware, the state personnel director, Secretary of Labor, and also the CEO of Urban League, and ran for office for the first time in my 50s. Had never run for anything before, but ran for office and came in the same time as the current president, which was a really important time to be in Congress. And I am really excited and blessed because I get to serve on the Energy and Commerce Committee. And one of the 4 of the 6 subcommittees that I serve on is the Health Subcommittee. And so I am excited and proud to be here, looking forward to the conversation, and especially all the work that you do, especially right now, as we are on the front lines and we know that we are being more impacted than any population in the country. And we need to be discussing things like testing, contact tracing, as well as the vaccine. So I'm excited to be here, and I thank you for all of your work. Thank you so much.
Thank you, Congressman Blunt Rochester. We're so pleased that you'll engage us in this dialogue this evening. Next, we would like to announce our next panelist, Dr. Lauren Powell. Dr. Lauren Powell serves as the Vice President for the Head of Healthcare Industry for Time's Up. Dr. Lauren Powell, thank you for joining us this evening.
Well, thank you so much, and good evening to everyone. Thank you for the opportunity to join you for this super important and very timely conversation. I'm excited to be here representing the interests, certainly of Time's Up, and specifically Time's Up Healthcare. We're an industry-specific initiative that focuses on the need to eradicate racism and sexism from the healthcare workplace, really recognizing the need to uplift and recognize women, in particular Black women, who are contributing so much to our workplaces and also to just our communities at this time. And so I also, in my former life, have been a state health official, was formerly the director of health equity for the Commonwealth of Virginia. So was overseeing the efforts to achieve health equity for 8.5 million people in Virginia. And so I bring that to this conversation as well. So really looking forward to our discussion this evening. Thank you.
Great. Thank you, Dr. Powell. And our fourth panelist, Dr. Kimberly Manning, who joins us from Atlanta. I'm sure some excitement down there in Atlanta, Georgia, as well with the election. So Dr. Kimberly Manning, she's a professor of medicine and associate vice chair for diversity, equity, and inclusion at Emory University. And Dr. Manning, thank you for joining us. And if you'd please introduce yourself to our national audience.
Greetings, everyone. I am so honored to be here, and I'm actually sort of fangirling over a few of my co-panelists, so I'm very excited about that. You're right. I'm bringing you greetings from Atlanta, Georgia, where there is lots of excitement about what we are feeling quite hopeful will happen soon here. I work at Emory University School of Medicine. Specifically, I work at Grady Memorial Hospital, which is a safety net hospital in Atlanta, Georgia, serving our underserved patient population here. And I spend my time between teaching medical students and residents, but also much of my professional effort is spent on efforts in diversity, equity, inclusion, and anti-racism at Emory in the Department of Medicine. And it's a really important role, a really critical role, and one that I'm proud we had in place before the death of Mr. George Floyd and Mr. Ahmaud Arbery, that we already had something in place. And so I really like thinking about our pipeline. I like thinking about creating spaces for people who look like us to show up and bring their entire selves to work and to use their cognitive effort only on learning and being and taking care of patients instead of on trying to code switch and be somebody other than who they are. I'm really pleased to be here.
Great. Thank you so much, Dr. Manning. And as we are about to transition to our questions for the panelists, do want you guys to know, look at Black women in synergy and in like mind. We all wore holiday festive colors. That was not planned. We're all wearing red, green, and white. I think I'm the lone one in white. But look at us bringing you some holiday spirit and cheer for this dialogue. So to just overview the evening, we have 4 panelists and we have 5 predetermined questions. I will open up with our first 2 questions, and then Dr. Burt will transition for the latter half of the conversation. We do want each panelist to have the opportunity to answer each question, and we have a question that's specifically tailored for the panelists, so they will we'll address them in the order in which we want them to answer. And for our audience, I'm already seeing the chat. There's a lot of comments already, panelists. So we will be monitoring the chat, letting you know what they're saying. We encourage anybody to submit questions that we hope to answer near the end of the evening as well. All right. So again, we are going to talk about a healthcare evolution. And we chose the word evolution in the sense of that at times we know that when it comes to healthcare, it can be a slower process and a progressive change. At the same time, it requires a catalyst, right? A force in which to move forward when we think about evolution. And so today we want to talk to our panelists about the framework of how we engage influential leaders, especially Black women leaders from all corners of healthcare who can be that catalyst to drive that change. So to start our discussion, we want to ask each of our panelists, given the current healthcare landscape, what do you believe is the primary catalyst or initiative needed to drive healthcare delivery and outcomes in the right direction? And we want to start with you, Dr. Freeman, given that you are on the national platform for the National Medical Association. What would you see as that primary catalyst?
Well, thank you for having me this evening. This answer might seem a little bit odd or maybe just overly optimistic, but I honestly think it's 2020 itself. I feel like 2020 has been a magnifying glass for our country. It's been a magnifying glass on the inequities that exist in our society, on the injustices that exist. I think it's really forced our healthcare system to look at the issues from many different angles. The truths that many of us, I think, on this session have known for quite some time, but has revealed this to our colleagues. And I think has really motivated a number of people who may not have realized our ship was going in the wrong direction, and motivated them to now kind of get on board and help us in righting the ship.
Thank you, Dr. Freeman. As you mentioned, 2020, and given that this has been an election cycle, local, state, and national election cycles, I think it'd be great to go to Congresswoman Rochester to talk about what that catalyst might be, given your, earlier positions as Deputy Secretary for Delaware Health and Social Services, and even in your work with the Department of Labor, seeing just different aspects of government. What would you say is that primary catalyst to really drive healthcare forward? And Congresswoman Rochester, we want to make sure we hear you. Fantastic.
I was just saying, I'm so glad that Dr. Freeman went first, because I think she really laid the foundation for the answer to the question. When I think back over the years of work that I've been engaged in, and just seeing what has happened historically in our country, I mean, going all the way back to the inception of us coming to this country. And I think that it isn't really an initiative that will be the catalyst. It really is this present moment that is the catalyst. And as she said, COVID-19 shined a light on inequities and disparities that everybody on this virtual event knew existed. And I can tell you, back when I was Deputy Secretary of Health and Social Services, I remember we had lost our Office of Minority Health, and I made it my personal passion to try to get the office reestablished, to the point that I ended up getting high blood pressure, which just shows you how crazy that is. And it gets to the systemic and institutional challenges that we face. And so in order to see change, I believe that instead of creating an office over here, a program over here, we've got to have an equity lens on everything that we do. And it's not just related to healthcare. It ties into so many other issues that when we talk about the social determinants of health. So to me, if we want to see a shift and a change in those outcomes, COVID-19 shined a light and made the case. Is in our face. And now, and we are feeling it personally with so many of our friends and families and relatives passing. And now, you mentioned an election. What we now have is even an administration that's talking about doing things through an equity lens. And even in Congress, the Energy and Commerce Committee has, for the first time, developed an equity task force as a part of the work that we do. So I think I would agree with Dr. Freeman. 2020 has been that catalyst.
Great. Congressman Rochester, I believe that the term equity, and I want to make sure that I say that again, equity, right? Ensuring that all people are receiving the needs that they need, right? Meeting them where they are. I have a feeling that theme is going to continue to come up. And so I just want to restate that word for our audience of equity. And really, as I transition to Dr. Powell, right, in terms of Time's Up, right? Big Time's Up was created, right, at a time when a catalyst was needed. And so, when we think about gender equity, and I would love to hear from you and your perspective about what you think the ongoing catalyst will need to be in terms of healthcare.
Well, thanks for that. And I think, I appreciate my fellow panelists who have already really given a great foundation on which to sort of just extend a little bit. I think the catalyst really, as we think more about this year, as we think about gender and equities this year, I can't help but think about key moments of this year around Black women in particular, the murder of Breonna Taylor, the injustice of the outcomes of the court proceedings or lack thereof for her murder, the fact that there was no one held responsible, the fact that that was on international display during a time when no one could look away. I think about the woman most recently whose name slips my mind at the moment, who was accosted in her own home, who was police, kicked down her door in Chicago, and she was there naked in front of several police officers, and the humility, or the lack of humility, and the embarrassment and just shame and complete disrespect. I think moments like these, in which America cannot look away, are catalysts and are important moments that will, I'm hopeful, will continue to make people very uncomfortable, will make them question what they actually know to be truth or reality, and that has waterfall implications and domino effects into the other systems, such as healthcare. And we think about, the implications of that and what that means for women who are trying to navigate these workplaces and who are wanting to just come to work and be able to do their job free of sexual assault, free of sexual harassment, and the messages that are sent about how Black women are treated. I think that is a catalyst. And I'm hopeful that that will result in creating a healthcare system that actually caters to and works for Black women in particular, because in doing that, it will ultimately work for everyone.
Thank you, Dr. Powell. And again, we hear the term equity come up. I think that's very important in talking about how women have been influential. And Dr. Manning, I mean, you mentioned that, Emory University had some structures in place already before 2020 when it came to equity. So it seems that the university and those leaders really saw the importance, right, for a driver to move healthcare forward. And you've been engaged. I think if I talk about all the equity initiatives that you've been involved, that would take up our panel. And I think one aspect that you've really contributed is dialogue, external dialogue through social media, through the programs that you run, through medical student training. And so it seems that you have a lot of different lenses. And so we'd be curious to hear, what has been the driving force for you, and what do you think has been that central catalyst about getting healthcare to go in the right direction?
Thank you for that. And thank you for all of the amazing comments so far, because you've made it much easier for me. What I'll say is I think that one of the main catalysts has to be building trust. And so as I think about my own contributions, I think about what ways can I help build trust and keep the door open for more narrative. I think that's very important. I mean, we're in a critical time right now. And I think that if we're able to allow some transparency in what is not right and what is right, get more people to the table, and more people to the table as themselves, not as puppets. I think that's really important, particularly for those in education, to do this work, right? At large institutions and large universities, it's not enough to just take somebody and put them on a task force and give them a title, but don't protect their time financially to do that. Don't allow them to have any administrative support to do this kind of work. I think that if we deem diversity, equity, inclusion, and anti-racism as important, there will have to be treasure connected to it. And I'm fortunate at my institution that we've been able to do that. Those of us who work in this space, we have time protected to do this, to learn and to grow and to connect with our colleagues. I also think that the year 2020, as has already been mentioned, has really thrown structural racism and health disparities into relief. And as Dr. Powell said, you can't turn away, you can't unsee this anymore. And so what I'm hoping will happen is for those of us who are working in the space of trying to build diversity and getting more people at the table as champions, I think we'll have more voices there to allow the narrative to keep going. Because what I don't want is for all that's happened in 2020 to be, like your favorite toy that you then put away when you get tired of it. This has to be built and baked into culture, and has to become a thing that we just make a part of our norm. So I think in education, that's a really critical piece.
Absolutely. And so what I've really heard from the panelists, it's been echoed, right, that 2020 has been a catalyst, and in addition, in order to move healthcare forward, making sure we have an equity lens. And Dr. Manning, that new word of trust, right? And I think especially in our African-American community, the community at times, may not have the greatest trust in the healthcare system, for various reasons historically. And, I think to actually reframe it is that maybe the healthcare system has lost the trust of the African American community, right? And so I know that many of our entities are working towards rebuilding that trust, especially as Congresswoman Rochester has mentioned now with the COVID vaccine, right? And so, Dr. Freeman, I want to come back to you. You mentioned that 2020 has been a catalyst, and the National Medical Association had really been thrown right into the national spotlight in terms of talking about, health equity, COVID education. Again, how are we supporting women's healthcare, maternal mortality, et cetera? How is the NMA, really ensured that they are moving healthcare forward?
Definitely. Well, thank you. So I would say, for the NMA, these inequities, the importance of addressing them is not something that's new, of course, and it's been something that we've been discussed for a long time. But I think you're exactly right that we've been thrust right into the center where there's a bigger spotlight, a higher wattage. Our platform's a little bit higher in terms of the impact that we're able to make. And I think what's important for the NMA right now is recognizing with that more prominent platform that idea that you were just speaking of trust is incredibly important. NMA represents Black physicians, and it's incredibly important not only to our patients, but to us as physicians ourselves, that we have that trust and that we're able to do what we can to take care of our community. And so I think a great example of something that NMA has done in this space to take advantage of not only the spotlight that has been shown on the organization is the COVID-19 vaccine task force. So this task force was put together to really address issues related to equitable access to the vaccine and making sure that there was equitable representation within the trials. And I think they've been able to accomplish that in terms of making sure the message of equity was heard around the country, and specifically for the Black community.
That's great. Thank you, Dr. Freeman. And Congressman Rochester, coming to you, as you as Congresswoman, you are a national leader. Equally, though, you represent the state of Delaware, the residents. And oftentimes we hear, especially in elections, my one vote doesn't matter, right? And I think November 2020 exemplifies the fact that your vote matters and your voice matters, right? And so I think I'd be interested to hear in our audience as well, is that as a U.S. Congresswoman, how are you speaking on behalf of your residents about healthcare? How are you ensuring that their voices are being heard and that their priorities are put first?
Yeah, well, first of all, I want to go back to that word evolution, because I do think that, as was just mentioned, the issue of trust is so important. And we have, as a community, a lot of reasons to have mistrust or distrust. And so it's almost like Congress, where a lot of people like their congressperson, but not the Congress. People, I know, I love my doctor, Dr. Shauna McIntosh, who is, a member. And I think that we have to continue to build that trust. And as a member of Congress, I can tell you, in my state, we pretty much mirror the demographics of the rest of the country. But we have a lot of health disparities that we've been working on for a long time, which is why I get to this issue of systemic changes as opposed to programs. Even as the CEO of the Urban League, we were working on issues of diabetes. We were working on maternal mortality, and this was years ago, and we still see that the outcomes have not changed. And so, as a member of Congress, what I tell people, and what, the proof is in the pudding, it is what we legislate, and we have opportunities to legislate things that will actually move the needle. Right now, one of the bills that I'm working on is actually called the Caring for the Social Determinants of Health, because we can be creative with how we use Medicaid. If somebody is living in an environmental justice community, that one of those frontline communities, or there's asbestos coming in, can we use Medicaid dollars to fix the roof or to change the carpet? Just being more creative about what we have available to us. The same is true with appropriations. We in the House have the power of the purse. We have to put our money where our mouth is. And that is not just about, creating a program, but it is how we fund medical schools and how we support the institutions that exist. It is paying attention to the curriculum and what we're teaching and how we're training and preparing people so that they don't have unbiased and unconscious bias and conscious bias. There's so many things that we can do from a congressional level. And for me, it starts with me hearing my constituents, them talking to me and them telling me what they're experiencing. And we do that in town halls, we do that through our mail, we do that in a whole host of ways. Back to evolution, I think what is different is seeing so many Black women now in positions where they can take that voice and turn it into action. That's where the rubber meets the road. It's when you can really be in a position, when people can vote for people who have their interests at heart and are holding them accountable. That's where we can make a difference.
It's fantastic. And that is, the perfect segue to Dr. Powell about taking action, right? So at the inception and creation of Time's Up, it was women speaking out and saying, our time is now. We are going to take action. What you said, Dr. Powell, was interesting about not being able to look away. And I think at times, there's a narrative, there's a national agenda, and then it falls to the wayside when another topic comes. And healthcare, I think, is in this cycle. I'm interested to hear from you, right, how Time's Up has been able to ensure that the narrative of healthcare, the narrative of women's issues continues to stay at the forefront and is a national agenda item.
Oh, thank you. That's so very important. I think one of the most important things we're doing right now is calling out where women are. And we know that healthcare and public health is comprised overwhelmingly of women. And so despite the fact that in so many of our press conferences and so many of the spokespersons we see are unfortunately so often white men, we are raising awareness and constantly reminding folks that it is actually women, and actually specifically when we get down to the lower wage and hourly wage paying positions, women of color and Black women who are the foundation of our healthcare system, who are not only the foundation of our healthcare system, but also the foundation of our society, period. And so raising awareness with campaigns like Women on the Front Lines, where we are uplifting the stories and experiences of women, continue to push and to advocate for policies that not only impact women, but impact the entire society. We think about pay equity, paid time off, all of these policies that seemed like such a far stretch before probably March. And then all of a sudden, we've had people advocating for these policies for decades. And then suddenly people realize, a pandemic and potential livelihoods and liveliness are connected to these policies, and that actually my health is predicated on the health of my neighbor, and that population health is a real concept, and health equity is a real concept. And so in this really interesting moment where we see things that happened that we didn't think could potentially happen, very quickly they happened. Time's Up really has taken a stance in ensuring that women are not left out. We know that this is a she session, as it's been termed, a recession that is having a significant impact on women in the workplace, that caregiving is a challenge, and being able to manage not only household activities, but working from home as well. Continuing to raise awareness about the fact that we have challenges out here that are not falling equitably on the shoulders of everyone, and that most disproportionately they are falling on the shoulders of Black and brown women who have been the backbone of the country and of our society for hundreds of years.
Great. Thank you, Dr. Powell. And I appreciate you referencing the initiatives of Time's Up and Time's Up Healthcare, really to show that, again, as an industry, right, a national organization, just multiple initiatives that can really address a wide spectrum of topics that affect women. So Dr. Manny, I'm coming to you as we hear from our earlier panelists. So the National Medical Association is a national organization. Time's Up Healthcare, a national organization, right? Congresswoman Blunt Rochester, right, is a nationally elected leader. You're at Emory University, right, an academic institution, and oftentimes we say it's the four walls, right? We're within our four walls, but at the same time, medical institutions can make impact, right, whether locally, at the state level, or nationally. And if you could talk a little bit about, how you specifically or how medical institution can be that primary catalyst to drive equity and build trust in communities.
Yeah, so I think one important piece is who's at the school, right? And so very concentrated, intentional efforts at recruitment of Black and Brown people to be in your medical school, to be there, because once they're there, they are going to start to raise concerns and serve as those champions, as we mentioned already. Specifically for those in medical education and in education as a whole, I think it's important for us to think about how we build things like bias training, upstander, bystander training, cultural humility training into the curriculum. One example that we work on at Emory, for example, is how just as somebody is getting ready to give a lecture and they display all of their financial conflicts of interest, we also ask our faculty members, hey, why don't you also look at this lecture and see if there are any areas for potential bias in this lecture that you're about to give to these students? Because what happens is all of these students that are in medical schools right now, we deploy them out all over the world to be the people that are delivering healthcare. And so in our schools, I think it's critically important what we're saying, what we're showing them, the images that are being displayed in their classrooms. If they see images of skin, for example, is the skin always white skin? Is the skin always Black skin? If it's something like a sexually transmitted infection, what messages are we sending? And I think this is, again, why having a more diverse body of individuals in senior leadership roles sitting at the table to raise a finger and say, whoa, why don't you have this? Furthermore, I think the other piece that is important for medical education is not just diversity of race, but also socioeconomic diversity, broadening your scope to include the LGBTQIA community, intersectionality, thinking about those from the disabled community. I think the more diversity that you have, it will drive the excellence that you need to really create the types of physicians and caregivers that will be the ones to give that compassionate care and ultimately build that trust that we're talking about. Because really, at the end of the day, if your patient does not trust you, if they do not think you have their best interests at heart, if they cannot relate to you and you don't have enough cultural humility and sense to know what a patient means when they tell you, that they're running off, but it's diarrhea, or that there's been a minute, which is a long time and not a short time. These are the kinds of things that make us laugh, but they could be life or death for some of our patients if somebody's missing the mark.
Oh, this is great, Dr. Manning. And you mentioned the people, which I think is really integral, right? So the people of community and that trust, and the people that are driving that dialogue, and the people at the table that are leading. And that goes really great to what Dr. Powell had also mentioned, that as we really start to peel back the onion, right, we see at the foundation is women, Black women and women of color. And I think that's a really great transition, where in our first questions, we talked about the organizations and affiliations that you all represent as Black women. But I think we want to talk a little bit more about Black women themselves, right? Like, what are we doing? What makes us unique as these catalysts? And so I'm going to transition to Dr. Burt, who's going to just really lead the dialogue for the second half of our panel tonight.
Good evening, everyone, again. I did want to say, though, Dr. Powell, I believe you mentioned earlier, I had not heard the story of Miss Anjanette Young. And when you mentioned her, one of our audience members shared that with us. And I believe someone has said already tonight about keeping the dialogue going. I was floored to read that this raid happened February 2019. This is not a new, this is not a new incident. And as you have all shared so eloquently already tonight, that is one of the most important things that 2020 has shown us. And it's almost made it impossible to keep those blinders on. And so very, very important. Dr. Powell, this next question, goes to you. How have you witnessed Black women advance healthcare initiatives and promote dialogue for healthcare equity? This can be internally in your specific work area or externally with your platform.
Oh, thank you so much. I could go on about this question for hours because I think it has absolutely been Black women who are advancing the agenda on equity and health equity. I think about scholars such as Dr. Kamara Jones, who is a leading voice and has been for decades around the importance of the social determinants of health, around calling out racism as a social determinant of health and racism as a driver of health inequities. Her work has spanned so many years, and it seems like we're just now catching up to what she has been saying for a very long time. I think about the scholastic work of Kimberly Crenshaw, who is a law scholar and introduced the concept of intersectionality. That is, that we can't look at racism and sexism separately without looking at the overlap and combine of both of them and the impacts on Black women in particular. I think about women who are leading modern day, Dr. Joya Career Perry, who was leading the National Birth Equity Initiative and really calling out the needs to better shine a light on and intervene upon maternal mortality. I think about other scholars and some that are in our presence. I think about Dr. Manning and the work that she does constantly on social media, calling out inequities and working with training students. So I think, the bottom line here is that Black women change systems. It's what we do. And so the push and the evolution towards the revolution of health equity in the healthcare system will be as a direct result of the advocacy and leadership of Black women.
Well, Representative Rochester, I'm so sure that you can speak to how those voices are being heard and maybe trying to be silenced, but being heard in your house.
Yeah, I don't think there's a lot of silence happening these days. We are speaking up, and as you were talking before about just the incredible Black women who have spoken up, stood up, and really participated in speeding this evolution. I thought about some of my sister colleagues in Congress that are doing some phenomenal work. I mean, everyone from Robin Kelly from Illinois, who leads the Health Brain Trust of the Congressional Black Caucus, to Lauren Underwood, who actually has a background in healthcare, and came to Congress new and has hit the ground running. She, Alma Adams, and Robin all have a focus on maternal mortality. Then I look at Yvette Clarke, who is the vice chair of the Energy and Commerce Committee and is helping lead the equity task force in our Congress, to Barbara Lee, who recently fought, hard to ensure, along with the other members, there's a smaller group of us that have been focused on these issues, and fought to make sure that we had legislation, and it is included in this COVID package, that really ensures that dollars are not just going to some program, but that they are going to community groups, nonprofits, others that are trusted in communities as we do the work of contact tracing and trying to, deal with the issue of COVID-19. And so as I see them push forward, it inspires me. And even, legislation that I've worked on to deal with the trauma that, George Floyd's passing, Breonna Taylor, Ahmaud Arbery, we know in our own communities, we have individuals and just even driving, we feel trauma, historical trauma. And so I've even put in legislation, and for us to actually get these things to get in the bills, get in the appropriation bills and get the money behind them, to me is just symbolic of how influential and how hard Black women are working and pushing to make sure that we see real change.
Thank you. Thank you. You mentioned that trauma, and I just had a great interaction with a patient yesterday who's a social worker, and she taught me about primary trauma. These are areas you guys know about well. I'm an OBGYN. And primary trauma, secondary trauma, and vicarious trauma. I said, oh, that's what I experienced daily, that vicarious trauma as I engage my patients. So it's it was very eye-opening to me. I am turning next to Dr. Manning to answer that question. How have you witnessed Black women advance healthcare initiatives and promote dialogue for healthcare equity in your workspace or at the National Medical Association?
I think we show up. I think a lot of what Dr. Lauren Powell has already said is so true. We show up. But I want to share a number with you all to make sure it sticks in your head. So 38,074. So 38,074, according to the AAMC, I believe it was in 2018, was the number of individuals who reached the rank of full professor at medical schools in the United States. Of that 38,074, at the time that they collected that data, 269 of them were Black women. So that is less than 1% of all of the full professors in medical schools are Black women. Okay, now, since that has happened at my institution, we saw that, we were alarmed, and this was national. A lot of people were alarmed, and it made us realize that we really need to start working on our pipeline, right? Because what is happening is that Black women will come, they will show up, they will grind and work hard in their academic institutions, but not get promoted. And so, again, as I sound like a broken record saying we have to be at the table, but not just at the table. We have to be at the table, and we have to be more effective mentors, sponsors, and coaches. And recognizing that there's a difference between a mentor, a sponsor, and a coach. You know, if you like hip hop music, you know, your mentor is the person who gets next to you and teaches you how to rap. Your coach is the person who tells you you need to get in the booth and practice and make sure you get your work done. But the sponsor is the person who takes your demo tape and hands it to the producers. And my thing is, we got a lot of people out here that are like coaching people and telling them to move and groove. But now we're finally starting to understand what the people who don't look like us have been doing for a while, and that is sponsorship. And what I'm seeing more and more Black women do, and what I try to do every single day, is to look and say, who can I put on today? If somebody asks me to do something and I've already done it, and I say, you know what? I have already been promoted to full professor. Who do I know that this national opportunity would benefit, that could help them get promoted so that we can move that number from 269 to something way higher? So we have a lot of work to do, but I do think understanding the difference between a coach, a sponsor, and a mentor is a place to start. And I see that now that we're having this dialogue more, that I think Black women are now at the table. And with the He for She movement, there are more people who realize that, whoa, wait a minute, I have not been sponsoring Black women, and they are excellent and been excellent. So I think that this is an exciting time. So much has been thrown into relief, and people are really starting to move forward. And I'm excited about that.
Thank you. Dr. Freeman, at the House of Delegates now, how would you respond to that? How have you witnessed Black women advancing healthcare initiatives?
Well, thank you. I think one thing I've been thinking about just listening to my co-presenters' responses is that, as Dr. Powell said, Black women change systems, and I've been really fortunate to witness that my entire life, from my mom when I was a child and advocating within the systems that were against us in Texas, whether it's been as an undergrad, as a member of Delta Sigma Theta Sorority Incorporated, as a member of the National Medical Association, and looking at how our female leaders have not only made sure that they are making a change within healthcare, but a change within our organization and a change within the world. You know, I've been very fortunate to have mentors, coaches. I'm still looking for some sponsors out there, so please feel free to reach out to me about those. But really thinking about those examples about what we need to do as Black women, what we can do as Black women, and motivating me to continue to work and helping me to continue to motivate others, that, you know, we're really able to reach out to each other and connect to make a difference.
Thank you. Thank you. I was making sure I wasn't muted that time. So I'm here in Georgia, We hear about Stacey Abrams all the time. Of course, we just love her dearly, from her bid for the governor position in 2018. And now with the fair fight, and everyone, of course, is giving her the kudos. We know about Tamika Mallory and all the work that she's done with the Women's March and Black Lives Matter. You know, women are just out there. I'm looking at this distinguished panel that I have the honor to be speaking to tonight. For years, we've been pivotal in making an impact. So my next question is going back to Congresswoman Rochester. Why is it that Black women are so often on the front lines for change and can galvanize the community?
Wow. You know what? It's funny. When I hear that question, the first response that came to my mind is like, well, why does the sun shine? I mean, we are doers. We are problem solvers. We are creative. We take risks. Sometimes because we have to take risks, and sometimes because we're creative because we have to be creative. But I think that it is part of who we are. It's part of our DNA. And as you mentioned, Stacey, I think back to the year that I had where I was really blessed to be on the VP selection committee and to see some phenomenal women that were, you know, not just accomplished, but qualified, brought lived experience. And we see it in mayors across the country. We see it in doctors. We see it in leaders all over. And I guess my why are we on the front lines? Because we care. We want to see things better for our kids, our community, our country, and because we are able. And I think one of the things that has been so special about this moment in our history, for me, as we talk about evolution, and as I saw like hundreds of Black women write in and say, we would like a Black woman as the vice president, it was that we are really using our voices and standing up and being seen. And I think the whole goal for me is that we, with evolution, you don't want to go backwards, and I don't want to go back. I want us to just keep going forward. Keep going forward.
Absolutely.
Oh, I want to say one other thing to Dr. Manning. On the mentor coach sponsor thing, I was doing snaps. Y'all couldn't see me back here, but I was like doing the snaps because I love that. And that sponsor thing is so important. And that's what this is about. It's not just about me or you or, you know, I like Kamala said, and the same is true for me. When I was elected, I was the first woman elected from Delaware and the first Black person to go to Congress. I will not be the last.
Dr. Powell, I'm going to turn it back over to you. Why is that voice so powerful?
I'm sorry, was that for me?
That's for you, yes.
Could you repeat the question again?
We're just speaking on why is it that Black women are so often on the front lines of change and are able to do what we do?
Yeah. I mean, I think that I have to echo, you know, the representative's comments. It's like, because it's what we do. I think Black women are natural leaders. We are communal. We are conveners. We are ingenuitive and innovative. And we know that our freedom necessitates the freedom for everyone else. And so I think it is a deeply ingrained ancestral calling, quite frankly, for Black women to be on the front lines. And also at the same time, you know, I think it's important that we introduce the perspective and the need to recognize that there are different ways to be on the front line, that it is not always, we may not always have the ability to literally protest and to be in the face of white supremacy, in the face of calling out oppression on the ground. But we do it in lots of different ways. And for many of us on this call, we do it in our jobs every single day. I remember talking on panels and doing interviews and things around the time of George Floyd's untimely murder and modern day lynching, if you will. And remembering, hearing people ask about activism. And I think there's a spectrum to activism, and that it is not only protesting and picketing in the streets, but it is standing up and being a voice in a room of all white men and standing up and speaking the truth. It is being a sponsor, as Dr. Manning has called out, in a system that was never meant for us to be in it. It is writing policies and calling out the ways that policies can have unintended consequences on our communities and on our people right where you are. And so I think it is as natural to us as breathing. And that is why we are there all the time.
Excellent. Excellent. And to that, turning back to Dr. Freeman, same question, but not only is it, why is it that Black women are on the front lines so often? I'm also seeing, as many of you are, that just like the call for the VP to be a Black woman, in a lot of arenas, they're looking for you. They're coming for you for that very reason, for the leadership, because you are the ones able to, galvanize the community. So to Dr. Freeman.
So
why are they coming?
I think it's 3 words. It's Black girl magic. I think that's it.
We're snapping with you, Representative Rochester.
My co-presenters have told you why. It's Black girl magic.
Black girl magic. And the fact that I see so many people hashtagging that without apology, that's the piece that I love. It's without apology. So Dr. Manning, you want to bring us home on that?
Yeah, I will just say, come on, ancestral calling. That's what I will say to that. And you know what, me saying it like that, this is what I would do on rounds. I would be like, come on, ancestral calling. And this is what the reason I say that is because imagine how powerful it would be if we all show up as our entire selves, right? And I keep saying this over and over again. When people who are in leadership roles and who are senior show up as their entire selves and don't divide people into Black and white and spend all their effort code switching, and they just break people into formal and informal, casual and formal, or unfamiliar and familiar, but not where I have to tone down my Black girl magic, if you will, to make it more palatable for you. Because truthfully, this is this is what you want anyway. When you look at all of the, it could be a whole different conversation about cultural, appropriation, but there is so much that people admire about what is just natural for us. So now I just go on rounds and I just bring my entire self to work. All the Black girl magic, all the Tuskegee University, all the Meharry Medical College, all the Delta Sigma Theta, all of it. Inglewood, California. I'm bringing all of it. And you know what I say to this is, come on, ancestral calling. I got eyes in the back of my head that can see that my son is not doing his homework. I got eyes on the front of my head to see that you're trying to do something to my husband. I got eyes on the side of my head to see that you're trying to disrespect my patient. And I got eyes on the other side of my head to say, you're trying to disrespect me. And guess what? That's ancestral calling. Come on, ancestral calling. Amen. Come on, ancestral calling.
Dr. Manning, that's the last question. I only have time for one more. I'm going to ask this of you. When it comes to leadership positions, Black physicians and healthcare officers frequently occupy the diversity, equity, and inclusion space, where DEI endeavors are critical and Black women perspectives are essential. How can we equally occupy leadership positions for other medical or health spaces?
Yeah, so it's a both and. I mean, the thing about diversity, equity, and inclusion efforts is that they help you create equitable, fair, and comprehensive search committees. So if you have a search committee that does not understand that they need to have a certain number of Black women or Black men or people of color that are in the applicant pool, then you're never going to get people into those spaces ever. So I think that DEI work is a really important foundation for us to elevate people into other roles. Furthermore, it just goes back to sponsorship again, because if you think a hospital system that's looking for a CEO doesn't start with word of mouth, you're crazy. I mean, right? Everything starts with word of mouth. A lot of stuff is who you know that's excellent. And again, as we keep climbing the ranks, we'll get in spaces where we can say, oh, I know somebody really excellent to be your CEO, your CFO, your CMO, the head of your entire hospital system. I think that's what it has to be. But the DEI work is what allows us to raise the red flag and say, yo, what's up with your search committee? Why is it only a lunch with one person? It needs to be formal, and it needs to be structured and methodical. And I think those are the ways to get more people into other leadership roles. And then as you start to see more people in leadership roles, I believe that like institutions will redefine what a leader looks like, what a CEO looks like, what a CFO looks like.
Great. Thank you so much, Dr. Manning, for that. And I think that really allows us to go to our final question for the evening. That'll go to all of the panelists. As you mentioned, making sure having the right people at the table, and that includes us as Black women and women of color. And so, Dr. Manning, we'll start with you, and then to Dr. Powell, to Representative Rochester, and then to Dr. Freeman. So how can your organization, how can your space increase the involvement of African-American women to greater influence the healthcare evolution so that more of us are at the table and more of our voices are being heard?
So I'll keep my comments short, and I'll say just giving people permission to be. I'm a nerd who loves Hamilton, so I will quote this, which is, "Who lives, who dies, who tells your story?" I mean, and at the end of the day, we have to tell our own stories and give each other permission to bring our entire selves into spaces so that we can free up all that cognitive effort and really unleash the excellence that we have, unleash all that ancestral magic, if you will. I think that's a really important piece.
Well, I'll just say, I think from the perspective of Time's Up, that as an organization, we're rooted in gender equity, and traditionally gender equity movements have been exclusionary of Black women, of trans women, of women of color, of women of lower socioeconomic status, and has exclusively focused on white women. And so as an organization, I think we are taking strides and being very thoughtful and intentional about the need to ensure that there's an intersectional lens in our fight for gender equity, and recognizing that the freedom for all women is predicated on the freedom for Black women.
Am I next?
Yes, ma'am.
Okay, thank you. First of all, I want to thank you for this was an incredible conversation. It lifted my spirit, it lifted my soul. And I guess I would just say in my profession, there are probably two ways. One is to help more women get elected, like I did, to help be that coach, that mentor, and that sponsor. And that's something that I take personally as a part of my mission. And then the second thing is even in our hearings and in our opportunities for people to give input. So I encourage each of you to reach out to your congressional offices and to reach out to my office. I'm on the health subcommittee. Giving people a voice and a seat at the table is another way. And I will end with, I too love Hamilton. I'm a Hamilton fan. And as I think back to who we are as Black women, I also think of my faith. And it is my faith that has sustained me, even through the loss of my husband, which propelled me to even run for Congress. And I will tell you, in Hamilton, there's a line that says, legacy is planting seeds in a garden you will not see. We have an opportunity to create legacy. That's why we do this.
Thank you. And actually, I feel like I had the easiest one for that question because it's exactly what you, Dr. Posse, and you, Dr. Burt, are doing. For the NMA, what CCWP is doing, pushing the conversation, giving us this these spaces to have these conversations. You're pushing the change, you're doing the training, you are making sure that the women of the NMA are going to be ready to push the healthcare evolution. And so I say thank you for having me tonight. Thank you for having this dialogue. And thank you for doing what you're doing and your commitment to the National Medical Association.
Great. Thank you so much to all of our panelists, Dr. Kimberly Manning from Emory University, Dr. Lauren Powell from Time's Up, Representative Lisa Blunt Rochester, U.S. Congresswoman from Delaware, Dr. Brandy Freeman, representing the National Medical Association. Both Dr. Burt and I just been so pleased and enthusiastic to host this dialogue this evening. And echoing Dr. Freeman's comments, the National Medical Association this year is celebrating its 125th anniversary of the leading force of justice and parity. And one of our primary initiatives is ensuring that Black women physicians are at the table and in leadership. Now, as a physician, I'm a student. So when Dr. Manning was talking in numbers, I started writing 38,074, 269 Black women as full professors. And with that, the CCWP, the Council on Concerns of Women Physicians, and the physician executive sections of the NMA has actually partnered with the National Institute of Health to ensure that we are training and developing more women physicians as leaders. And so we are pleased to announce that we will have a new initiative launching starting in January called Sights on New Heights, Elevating Black Women as Leaders in Healthcare. Well, we will have hands-on training, webinar series, and educations to ensure our NMA women physician members are at the table and continuing to lead that charge. We are so fortunate to have that grant funding from the NIH Office on Research for Women's Health. And again, with the physician executive session, we're going to make sure that 269, Dr. Manning, 269, that we are increasing that number, both in the clinical space, in the academic space, and perhaps even in the government space, and having some of our physicians run for office. So tonight, I definitely want to thank again all of our panelists. Dr. Burt, thank you as our vice chair for CCWP as co-moderating. Also want to thank Dr. Shonda Holsley, who is our NMA social media manager and our production manager for tonight. She's behind the scenes, and it's usually those that are behind the scenes that are doing a lot of the work. So thank you to her. And especially thank you to Dr. Leon McDougall, our 121st president of the National Medical Association, for his work and his unduly support of our women physicians in the NMA. So I want to thank you all this evening for participating. Thank you for supporting the work that all of our panelists do in their spaces. I want to wish you all a happy holidays and a happy new year. Thank you so much. Have a great night.